everybody, today in my video I'm talking about what's next after the diagnosis of dementia for your parent or for your loved one. So stay tuned. I'm going to give you some observations of what I have noticed with my own mother, with my relatives and friends' relatives, and from visiting my mother in the memory care facility where I see all sorts of dementia patients with both vascular and Alzheimer's disease. So stay tuned for stories about what you might expect next after your parent receives a diagnosis of dementia. So my name is Dawn Dickinson and the channel is Reflections and Insights for Life Over 55, and the purpose of this video, I am not trying to give you medical advice or anything at all like that. What I am trying to do is share some stories of what I have experienced with the diagnosis of my own mother with both vascular dementia and Alzheimer's disease about 3 years ago, and some of the things that I've noticed with my own mother, with my aunt who has the dementia, with my friends' parents who had the dementia, and a lot of the information I have just observed. So these are anecdotal stories, of course, observed when I visit my mother in the memory care facility. I often will sit in the common area with her because all the old people seem to like it. You know, oh, we're here with Marie's daughter, and I talk to all of them and they seem to enjoy it. So a lot of it is observing some of the other patients who are also in the memory facility who have Alzheimer's or vascular or any of the other types of dementia. So I'm going to start going back. My mother was diagnosed with both Alzheimer's and vascular dementia about 3 years ago, and so these stories are things that I have encountered that may or may not happen in your life with your loved one after the diagnosis. But I want to tell you about these things so if they happen, you're not totally shocked. Maybe none of them will happen, maybe one or two of them will happen, but I don't want you to be totally shocked and taken off guard. And the other thing is I don't want you to feel guilty or responsible if any of these things at all should happen to your parent, because these are just things that could happen with the progression of the disease and they're not your fault, and I don't want you to think that they're your fault or that you did anything wrong. So the first thing I'm going to talk about is I have noticed with a lot of the patients, not just my mother, but there sometimes is a personality change. It seems like more often it happens that person who was a nice, kind and understanding person becomes a little bit mean and cantankerous and always in a bad mood as the disease progresses. But that's not always the case, because in my own mother's case, not that my mother was ever mean, but it seemed like as she got the dementia, she became more of the nice old grandmotherly type that you might expect from an old lady or an old grandmother, more so than she was before. She seems more loving with the children, the grandchildren, and her own children, although she does go through swings where she's quite nasty and cantankerous. But overall, if you would catch her on a day, a typical day at the memory care facility, she seems to have become nicer as the disease progresses. But I have seen many cases where the personality change is actually worse and they get mean and they're terribly nasty to their kids and grandkids, and hopefully that doesn't happen to you. But if it does, again, just don't feel like it was anything that you did. That's something that you might experience as the disease progresses, because I've noticed that quite often, a personality change in the patient. So another thing is sometimes your mom or dad or the patient will think it's 30 years ago. And so not always evident at first, but sometimes when they're doing the questioning, the first thing they'll ask is, what year is it? And they might say, oh, it's 1997. Or they'll say, well, who was the president of the United States? And they'll say, oh, it's Bill Clinton. Or, oh, it's Ronald Reagan. So that's a clue that they think, you know, it's 30 years ago. And sometimes their memory seems to progress backwards. I'm not sure why that is. Sometimes they're looking for people that you know have been dead for 30 years. Oh, where's my friend Ilsa? I haven't seen her in a while. Do you know what's up with Ilsa? And it's like, yeah, Ilsa died in about 1986, you know? So that might be a clue. Their memory is kind of progressing backwards. And in my mother's case, my sister bought her a clock. It's like huge. It's a digital clock, and it will say, today is June 7th, whatever date, you know, 2023 in large letters. And yet with that clock in front of her every day, she still will not know what day it is or what time it is. Or, you know, I'll come visit her on Christmas and she won't know it's a holiday. She won't know it's Christmas or Thanksgiving. So again, them thinking it's 1997, that's not too uncommon, so don't be shocked if that happens to you. So another thing that could happen is they might start hallucinating, which is, you know, a troubling sign, but I don't think it's all that uncommon. So for instance, my mom will often say that somebody's breaking into her room and stealing her things. And I don't think it's just my mother. I see a lot of the other old ladies when I come visit, they say, oh yeah, they break into my room and they stole this, when actually they probably lost it. A lot of times they say, oh yeah, they steal the underwear out of my drawer. They're always stealing our underwear. And I think what's happening here is a lot of the patients, they don't wear underwear anymore. They wear adult diapers or Depends. And so there's no underwear in their drawer. And when they go and can't find the underwear, they just assume somebody's broken in and stolen it. But it's not just stuff like underwear. They're hallucinating. You know, somebody was in my room at 2 o'clock in the morning. My mom will call and say that. Well, she can't really call anymore, but when I talk to her, she'll say, somebody was in my room at 2:30 last night. Somebody broke into my room. So they're hallucinating, or they'll see people that have been gone for years. One instance was particularly troubling, is one of my friends from the art club, and this was, you know, about 15 years ago, but she said her husband had the dementia, and one night she was in her bed and her husband came in and she said, who was that man in her bed? He was hallucinating that she had a lover in her bed and had went out to get an axe so that he could come kill the intruder in her house. Now, I know that, you know, she didn't end up getting insulted, but she was, you know, terrified when telling the story. You know, Jim thought I had a lover in the house and he went out to get an axe. And you might be wanting to put him in a facility if he's getting violent and hallucinating in a way that could hurt you or somebody else. So the hallucinations is something that could happen, and it's very troubling, and hopefully it won't happen in your case. Another thing that could happen is episodes of panic. And this is very troubling when this happens. She doesn't know where she is. A lot of times she would call me in a panic, you know, where am I? But they might go into a panic. They don't know where I am. Or my mom will say, I have no food. I don't know what I'm going to eat. I have no food. And I have no money to buy food. I was going to walk over to the McDonald's across the street and get some food. Well, first of all, there's no McDonald's across the street. You can't get out. If you did try to go to McDonald's across the street, and in Phoenix, we've been in a heat wave. It'll be 118. She would die of heat stroke before she even made it across the street. But she thinks she doesn't have any food, even though the facility feeds her at least 3 times a day plus snacks. So I'll say, oh mom, you know, don't worry, they're going to serve you lunch at 11:30. And she's like, oh, they feed us here? You know, oh yes, mom, you know, but then 10 minutes later, she'll forget and go to the same panic again because the short-term memory is totally gone, does not remember that they feed her, and will go into a panic because she's got no food. Well, of course you have no food because they feed you. They got a whole kitchen and staff. You don't have to cook anymore. Mom, remember, you haven't cooked a meal in 10 years. Well, not quite 10 years, but you know what I mean. And then trying to escape, they're often trying to escape as you're going into the room. It's very difficult to get in and out of the facility because somebody has to let you in and out because the patients are always trying to escape because they're panicked. They don't know that they are. Sometimes they think they've been kidnapped and being held against their will. So the panic that often comes along with not knowing where you are or not knowing who you are is very real and very troubling. So hopefully that won't happen. But if it does, just realize it could be a symptom of the disease. So another troubling thing I have noticed is people that become violent. People that were never violent in the past are suddenly violent. And I do remember visiting my mother about a year ago, and there's this very big old man, but he is in a wheelchair, and he was mad about something. And he is screaming at the staff, screaming at the nurses. There's male nurses, female nurses, and they've obviously been trained to handle this because this old man is throwing punches. You know, he's like, poof, poof, like, boom, and they're right out of reach. They're like 3 inches from getting their face smashed in with this huge fist, you know, and they're like, you know, Mr. Johnson, you need to calm down. I don't need to calm down. And he's screaming and swinging and kicking, and then they'll take his wheelchair and they'll kind of like wheel him into the corner and sit him there. Okay, Mr. Johnson, you need to calm down. We'll give you a couple minutes, and they'll give him maybe 2 or 3 minutes in the corner, and then they'll come get him again, and it's the same thing. He's screaming and punching and kicking, and you go through the scenario. It's kind of like a little child when they're having a temper tantrum. You put them in timeout, and then hopefully they'll calm down, and they'll do it as long as it takes to get them to calm down. But these violent outbursts are something that might happen to a patient that was never violent in the past. And the other thing is, my mother the other day called my sister late at night, and she's screaming and threatening my sister and threatening the nurses. It was terrible, but probably the most troubling was when she was in the hospital last time, and she was mad that they weren't releasing her fast enough, and she actually bit one of the nurses. I mean, like, chomped down on the nurse. Oh my God, I didn't even know what to think, what to do. Then the other thing she did in her last hospital stay, she actually was ready to go, so she rips the IVs, rips them out of her arm, and now she's bleeding. She's got like a 4-inch gap in her arm where she ripped out the IV, and then she ripped out the catheter. So she's bleeding, she's leaking, she's got gashes in herself because she is so violent that she's physically tearing and ripping the stuff out of her, and then she bites the nurse. I mean, all this, like, we were besides ourselves. We had no idea what to do. We've got actually a thing in the place now to not send her to the hospital because she's hospice and they're not curing her. You send her to the hospital and they won't give her the surgery she needs because they say she won't survive it, and they send her home. So why go through this experience again? But just be prepared. If anything like that happens, it's actually horrifying and terrible, and hopefully you will never experience that. But the violent outbursts is something that could happen, and hopefully it never will. Okay, so another thing that could happen is they get these crazy new ideas or beliefs, and they come up with them. Where they come from in their brain, I have no idea, but they'll spout them out like they're fact, and then suddenly the other people will believe them too. The other thing is, she said, oh, your grandmother came last night and brought me that mini fridge. You know, she'll point to the mini fridge that has been in the facility since we moved her in. In fact, my sister and her husband brought the mini fridge in and delivered it, but she says, oh, you know, your grandmother brought that in. You know, she wheeled it in. You know, she's been dead since 1995, but yet she wheeled it in a hand truck. You know, like, say, if my grandmother came back from the dead to visit, I'm sure she's not delivering with a hand truck a mini fridge, but she'll get this crazy idea and then they believe it, and everybody else is like, oh yeah, that was so nice, you know. Or the other thing is, she would say, oh, this walker belonged to your other grandmother, you know, who died in 1993. And, you know, your dad and your uncle wanted to get rid of it. But I said, oh, no, that's a good walker. Let's keep that. So, yeah, I rescued this from, you know, being thrown away. Like, right, you know, I know that my sister bought that for you when we moved you into the facility. But in her mind, it was really my other grandmother. But probably the most outrageous one was when there was an old lady that was looking for her husband. So her husband actually was probably dead for 20 years, but she's walking around, you know, I'm looking for my husband Bill, have you seen him, you know, and nobody's seen him because he's been dead for 20 years, but my mother pipes up, oh yeah, you know what happens around here is if they see an old man sitting around by himself, they'll take him and they'll put him to work and have him do some chores. And I'm like, oh really, Mom? There'll be an 85-year-old man in a wheelchair and they're gonna snag him and have him plunge old Bertha's toilet or make him go out into the courtyard and trim the weeds out of the flower garden, you know. But like, everybody's, oh, okay, that could have been what happened, you know. And they all believe this outrageous story, you know. They're all paying $7 grand a month to be taken care of, but I guess they have to subsidize it by pulling weeds in the garden because the old man is sitting there by himself. Yet they come up with this idea and they believe it, and they all believe it, and you don't argue with them. Never argue with them, because you're not going to win. Just like we went there on my mother's 82nd birthday and she's telling me I'm 70 years old today, and I'm like, oh really, Mom? All right, you know, don't argue, just let them believe it. So another thing that could happen is they become very demanding. Like, I'll show up and she's like, oh, Dawn, I need you to drive me home. Let me get my things. I'm going to get in the car. I need you to drive me to home. And I'm like, oh, you know, we sold your house 3 years ago. In fact, you wanted us to sell your house so you could move into that nice assisted living facility, which actually was the case. We sold her house, moved her into a nice assisted living facility that she'd wanted, but then we did eventually have to move her to memory care. But in her mind, she's ready for me to take her home, and she wants to go home right now. So drop everything and let's go home right now. The other time was when she called me and she had been in a rehab facility, and she calls and said, okay, I left the rehab facility and I'm across the street in the bar. I need you to come get you, but don't come to the facility. I'm in the bar. I'm waiting. Come get me at the bar. You know, like, holy crap, I know you didn't escape from rehab, and I know you didn't get across the street because you wouldn't have made it across the street, and now you're sitting at the bar, but she's demanding, now, I need you to come now, I'm waiting too long, you know. So she is very demanding, and that can happen too. So that's terrible. But the last thing is probably the most heartbreaking thing, and that's when they don't know who you are. And I don't usually ask my mom if she knows who I am, because I don't need to break my heart every time. Sometimes she'll recognize me, and she might recognize me but still not know who I am. Sometimes she'll say, oh, I'm sorry, I don't know who you are. Could you tell me who you are again? Or she'll say, oh, I don't know what's your name. Can you tell me your name? And, oh, you know, your heart, like, you could feel it, like, cramp up in your chest. Oh, Mom, you know, I'm your daughter, Dawn, you know. Oh, okay. And then sometimes I know she doesn't know who I am because she'll say, oh, I'm looking for my husband, Jack. Have you seen my husband, Jack? And so now here's the double whammy. Like, right? I know she doesn't know who I am because obviously her husband, Jack, is my dad. So if she knew who I was, she'd say, where's your dad? But so first, she doesn't know who I am, and then second, she doesn't know that her husband, Jack, my dad, has been dead for 19 years. So the first time it happened, I had to say, Mom, Dad's been dead for 19 years. And now she's arguing with me, no, you know, and then I'm like, yes, Mom, you know, of course he would be here to visit if he was like, and then she starts crying. Like it's the first time she realized her husband was dead, you know, and then, you know, she's distracted like squirrel and she's forgotten. But again, now I'm like crying because it's now when I just learned my dad was dead, you know, I'm experiencing that emotion again. So some of the therapists say when that happens, if they ask you questions, it's okay to do the white lie. And if she asks me that again, because she asks this frequently, where's her husband, Jack? My dad. And so instead of saying that he's dead, I'll say, oh, he's working late. But that also clues me in that she doesn't know who I am. And then oftentimes she will say, you know, I can't remember how many kids. Do I have 2 kids? Do I have 3 kids? I'm like, oh, Mom, you know, it's me and my sister and my brother. Oh, yeah, 3 kids. Do I have 3 girls? No, yours, you know, my brother, and then, you know, me and my sister. Oh, okay, I've got 2 girls or a boy. And then she won't have any clue how many grandkids she has. She won't know who the grandkids are. Although she does seem to recognize my oldest son when he comes to visit. Like, if we're gone, he might not remember. But if he shows up, she'll remember him. And he's really easy to remember because he's, you know, 6 foot tall, has bright red hair, and he's autistic. So, you know, kind of a memorable character, and she'll remember him when he shows up, but she won't remember that she has. Do I have grandkids? How many do I have? Boys or girls? So when they start forgetting who you are, just know it's not that they don't love you. It's just something that can happen with the disease. Hopefully that won't happen, but very likely if they progress to the end of the illness, they no longer will know who you are, and that's very heartbreaking. But don't take it personally. Don't feel like it's something that you did or you're responsible for. Don't feel guilty about it. All of these things may or may not happen, but these are things that have happened to me and my family and what I've noticed for other people when visiting in the memory care. And I do seem to observe all of these behaviors continuously, kind of like recycle. That's the other thing, is you'll have a conversation and then the conversation is over, and then 3 minutes later the conversation starts again from the beginning because they've forgotten the conversation. So that's it. Those are things that you might expect after your parent has received the dementia diagnosis. It's very difficult, but I hope this information helps you. My name is Dawn Dickinson, the channel Reflections and Insights for Life Over 55. If you find the information helpful, please do me a favor and hit the like button and consider subscribing, because I post videos like this every single week, and it will help other people who are looking for this type of information to find the video, to find the channel. I hope you have a great rest of your week, and hopefully I will see you back here again next week.